Hi everybody, I'm Dr. Hester Wilson. I'm a GP and I'm a staff specialist working for South East Sydney Local Health District Drug and Alcohol. I wanted to talk to you today about health pathways. I've been involved in the production of our local health pathways over some years. First of all, I'll tell you a little bit about what they are. Now, they were first put together over in New Zealand, and they were focused, and they still are focused, on assisting people working in the general practice setting, in a primary care setting, to know what to do with different conditions, and they have information about what the condition is, how to assess it, treatment options, but most importantly, referral options. And as I say, they're directed at people working in primary care. But what we want to do now is open up these options as possibilities for all of us working in the hospital system. Now, we're working in our special areas, so we may not need information about our specialty, but it may be that there's other areas that we want to actually look at that would help us in terms of helping our patients. It may be that it's something that you can use to look at where else you might refer and what might be the other options that are available for your patient. Also, importantly, when you're referring your patient back to the general practice setting, recommending health pathways for GPs to actually check out and see what else is available for their patients. It also can be useful if you receive a referral for a patient from primary care where you're thinking, I'm probably not the best person, we're probably not the best practice. Sometimes we might call that an inappropriate referral. I'm not sure that I would call it that, but sometimes we're not the best people. And so maybe in terms of writing back to the person that referred, the GP or allied health worker, to point out on health pathways that there's a better option for that person and giving them those details. All GPs can access this, and I should say at this point that you do need to log in. So it is only for healthcare workers, not for the general population. But once you're in there, there's heaps of information on all areas of medicine, and it's really, really useful. So I really encourage you to go on and have a look at who you are and what your service looks like on health pathways, and take a look at health pathways more generally to see if there's options that can help you manage your patients, and also health pathways that you can recommend to others, whether it be other services within your hospital or to people working in the community. Just what we know since we've put together the drug and alcohol health pathways is that GPs very frequently are accessing this. Look, it's been put together by GPs for GPs with subject matter expert input to make sure that we're giving everybody the right information. But it's so user-friendly. It's one of those things where you can go, oh, alcohol. Oh, I'll just look up health pathways. I don't know much about alcohol. Oh, okay, so this is what I need to do. So quick and easy cheat sheets, quick and easy approaches in real time, short and sharp, that help us as busy clinicians. It's also really good for referrals as well. And that's one of the main reasons that I use it is, okay, so I've got this condition, what's the best way to refer? And quite often I'll have, because I've referred before, I'll have it in my software, my kind of general referral pathways. But if it's something that I haven't seen much of, really great in terms of referral pathways. And that's for all aspects of healthcare. So it could be general medicine, it could be surgical, looking at what are the options for referral. And it's particularly good for the public health options. There's so much information there, and there are new pathways being developed all the time. And the other thing is, if you want pathway developed, there's a particular one that you think is really important, get in contact with the guys at the PHN and encourage them to create a pathway that is either in your area of special interest and will help others, or is something that you actually need.